How do you know what implant size to get with breast augmentation? This is board-certified plastic surgeon Dr. Shim Ching. I'm based in Honolulu, Hawaii. I also practice in the Middle East, in Doha and Dubai. I've had over 25 years of plastic surgery experience, so I feel I'm uniquely qualified to talk to you about this subject. So one of the most common procedures that I do is breast augmentation. And one of the most common questions that I get regarding breast augmentation is what size I should get. Implants come in sizes that are basically described as cc, so 100, 200, 300 cc's, all the way up to 800 cc's that we have in the US today. What does that number really mean? It doesn't really mean a cup size. It can't really predict how big a woman is going to be, in the sense that they don't really know what that number means for them. And there's a lot of reasons why that number doesn't really correspond to any real size that a patient can sort of guess or feel confident in their decision about their breast augmentation. So when we refer to an implant size, we're talking about the volume, how much stuff, how much gel or fluid is inside the implant. And that gives surgeons a very convenient way to compare one implant to another. This is a very finite number, it's a very concrete number, 200, 300, 250, whatever. It's a very direct measurement of how much stuff is inside the implant, so we have an idea how much it will be when we put it in a woman's body. But for patients, it's totally different. Patients want to look a certain way. They want to fit a certain bikini or a bra or article clothing, and they usually feel that their smaller breast is not giving them the best look that they desire. Cup sizes come in A, B, C, D, and those aren't real measurements. They're supposed to correspond to how much bigger your breasts are in relation to the circumference around your chest. But some people's C cup could be another person's D cup, which could be another person's B cup. All this means is that the way that we usually describe breast size isn't really an accurate measurement. And a patient really has to go on a feeling or the perception that whatever size they get is the size that they want. One really common thing that happens in my practice is that a patient will ask a friend, "Oh, what size did you have?" Or they'll go on the internet and they'll see a patient with a 300cc implant. And what I mean by that is, if your friend gets a 300cc implant and you really like her size, unless she's your identical twin, meaning that she has the same height, the same weight, and the same breast size that she started out with, she's not going to be the same as you if you get that same implant. It's most likely that your breasts are going to be a different size than her. Breast shape also plays a role in how large the breast will be perceived. So all those different factors mean that a 300cc implant, although it's the same implant, can look very different on one patient versus another. I recently had a patient who had breast augmentation, and they actually watched these videos, so they won't mind me sharing. But she and her husband went around and asked people on the street that they thought they had breast augmentation, and they asked them what size they had. And I admire them for trying really hard to pin down what size she should get. But unfortunately, I had to tell them, unless they're exactly the same as you to start off with, it won't really matter whether they got 300 or 400 or 500, because we can't really compare them to you, because the size that they got, even though you like it, may not look the same on your body. So what should a patient do then? How do you find the best implant size for you? Well, I recommend there's a bunch of things that patients can do before they come in for their consult. And one is to find photos of women, ideally without clothing if that's possible, or even with light clothing that show a size that the patient likes. Usually with that kind of photograph, a plastic surgeon or surgery coordinator can give the patient an idea of what size they would need, what that specific patient would need to get to the size that they see in the photo that they like. So that's the first thing that I suggest most patients do before they come in for their consultation. Social media is full of these images nowadays, so it's really relatively easy to find images of breasts that a patient likes to bring them in to show the plastic surgeon. So after a patient comes in, we'll have a discussion on their desires and what kind of size they're thinking of. And if they come with photos, that's great. We can estimate what size they would need and they can try on those sizes. And there are two ways that we allow a patient to have a sense of what a certain size will do for them. One is the very old way, which is to take a bra, a standard bra, and we have implants that you can place inside the bra, and we can put in different sizes, and a patient can get a pretty good idea of what different sizes will do for them. So for example, they could put in a 300cc implant and compare that to a 400 to a 500. Take a look in the mirror, put a t-shirt over the bra, and that will give them a pretty good idea of how much volume they need to achieve the result that they want. The other thing we have is called Vectra. Vectra is a 3D camera, and there's a very fancy Photoshop-like software that's connected to the camera, so we can actually show a patient what their breasts will look like with certain implants even before their surgery. So it's almost like showing the after before the procedure. And this is very useful, and with the two methods, either using an implant on a bra or using the Vectra device, we can really get patient very comfortable with the size that they choose going to surgery, so they feel very confident about the size that they've chosen, and they rarely after the surgery will regret being too big or too small. So there's an important point there, and that is I don't like to tell patients what size they should get. I do a lot of revision surgery, unfortunately, and I hear a lot from patients, my surgeon told me to get this size and it's too big, or my surgeon told me to get this size and it's too small. So I really like to put the decision with the patient, because only the patient knows how big or how small they want to be. Surgeon doesn't really know. Even if I talk to a person for hours and hours, I'm never really going to know how big they want to be. I can't be certain that my decision is going to be in line with what they want. So I find the best way to make patients happy with the size that they get is to allow them to choose with the tools that we give them. Now, if the implant is way too big or way too small, I'll definitely guide the patient and tell them, well, maybe we should consider a different implant. But I tell patients it's my job to give them the size that they like, and I can make a variety of different sizes look good on them. So it's really up to them to choose the implant size that they want. So these are some tips on how to choose the best implant size for your breast augmentation. If you have any questions, please ask them down below. Like this video, subscribe to this channel, and we'll see you next time.